It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Welcome everyone to our health show. Now we're at a place that you don't want to be. However, if you are going to be at this place, you want to make sure it's safe and it's the perfect place to be for your health. Where am I? I'm at the ER department here at the Hazleton Lehigh Valley Hospital, Hazleton Hospital. And now today we're going to learn about what's going on here, my friends. I'm very excited about this show because there's a lot of people asking about ER, what's happening. My first guest is Dr. Kira Weaver. And Doctor, you have two roles here, which are?
So my first role here, well, actually I have three roles. One is I'm a practicing board-certified emergency medicine physician. The other two roles I have are more administrative. And so what we're talking about today is my role as the emergency department medical director. And then the other role is my trauma program medical director role, which have different responsibilities, but some similar overlay on what those responsibilities are.
Okay, so let's go back a little bit for the average person saying, okay, when you say, I'm going to see Dr. Lesante, and the question you have is, well, what do you know about Dr. Lesante? Does he have a good background? They want to know something about Dr. Lesante. Tell me about, what your training is for the areas that you're in charge of.
Okay, so my background as an emergency medicine physician, I completed residency in emergency medicine, and then I sat for boards in that specialty, similar to like if you were a surgeon, you sat for surgery boards. Emergency medicine has been a specialty for over 50 years. So our ER doctors here that work in our emergency department are board certified in emergency medicine. So we're trained to treat a variety of emergency conditions, anything from like heart attacks to strokes, which are some of the things we'll talk about today, but then also things like laceration care, trauma, and then we also provide like some critical care, like ICU level care with resuscitation of patients that are very sick with infections and other like medical conditions related to the heart.
It always fascinates me. I said you wouldn't want to be here, but if you do come here, you want to make sure you're in good care, okay? It always fascinates me when someone comes in, what do you know what to look for? I mean, because a person could be passed out or, everybody was in panic, etc. I mean, how do you control yourself here?
So we are trained to, obviously the first most basic thing we do is we're trained to look at people to see if they appear sick or not sick. And there's other things that we look at too regarding the complaint, patient's vital signs, history from when triage. All these things play a role into what, determines the acuity of a patient that comes in here, who's sicker and who's not. And that triage process is important because that ensures that the patients that are sicker, that need immediate resuscitation get that care. We also have processes so patients that have minor complaints, don't have prolonged times sitting and waiting for their care, so that people with like lacerations aren't waiting, things like that. But that's a system that also plays a role with like what our nurses recognize at the front desk or what our EMS colleagues advise us in the field. So we get this information from the patient, from EMS, from our nurses, and we use that to make those decisions on how to care for our patients best.
Okay, so explain that once again when you're talking about triage, because here again, you have some people that may have come to the emergency room and they're waiting, and all of a sudden someone else comes in and they go in before them, okay? And so sometimes you have people get a little upset because somebody else went in there. So explain to why that happens.
So that happens when patients have, and obviously it's difficult because, you don't know what's going on with other people around you and you can't discuss it. But sometimes what happens is patients that come in with certain complaints, maybe their vital signs, like their blood pressure's unstable, or their heart rate's unstable. We want to recognize certain complaints in certain situations that need immediate attention. And so that's part of where we go through and we meet with the patients as they come in at the desk to get that idea first of how, we're going to allot, our available beds and get those patients that are at risk for having what we call deterioration, like getting sicker, not to have them wait.
Okay, so now the roles you play, and explain each one so we understand, you have a new role and there's different roles that you play to help in good health care here.
So my new role as the emergency department medical director is a little bit different for me because I've worked clinically so far as a physician. And what that does is it enables me to practice medicine in a different way and contribute to the hospital. So I can be part of processes like, if we want to develop a new protocol or process to improve a certain aspect of patient care or quality improvement, like when we do, review cases to see, how can we provide care better? And so, we do this in collaboration with other specialties. We do this sometimes in smaller work groups. It allows me to work with other people in the hospital to improve care in our community, and that may affect more patients than when I'm working clinically and taking care of, patients in the department.
The trauma program. Okay, the trauma program, once again, you need to have, a lot of experience at. What has improved in the trauma program?
So the trauma program is actually one of my favorite things to be involved with here. I initially, when I started up here at LVH-Hazleton, I got involved with trauma kind of early on here. Mm-hmm. I have a background in emergency medical services. I was a paramedic before I was a physician in the area. And so with EMS, we do, we do a lot of different types of trauma care. And so when we work at a level 4, it's an early recognition and stabilization of the trauma patients. So when patients come in, we want to recognize life-threatening injuries, obviously provide resuscitation like blood products or medications to help with that, and see what patients need to be transferred to a higher level center. Although some of our trauma patients stay here at our hospital as well, like some rib fractures and some orthopedic injuries. And so, to be able to provide that care, it's a very time-sensitive matter because patients that may need surgery or immediate intervention, we obviously don't want to, have wait or sit. So what we do is, we have criteria that helps us determine, in addition to some of the other things we talked about, to help risk stratify, like to determine what patients do we need to activate our resources to get to the bedside quickly and provide that care. The other one with the trauma program that I'm involved with is that we do have a very rigorous quality improvement process. So we do go through charts and make sure care was adequate and timely. And this is set based on being participating in like the Pennsylvania Trauma System Foundation. And so they accredit us as a level 4 trauma center. And it's not easy to have that accreditation. They're a very rigorous program with standards that we need to meet, but it ensures that we provide not just good trauma care, but good medical care overall.
Doctor, how do you define trauma?
Trauma is basically, it's a variety of things. It's injury. Okay, so it's basically an injury, and it can be anything from a head injury, it could be a laceration, it could be a fracture, and so it's a variety of things. The tricky thing with trauma on top of it, sometimes there's a medical condition that leads to the trauma. Yeah. So that's what makes it very complex. Mm-hmm.
Speaking of that, when you're talking about trauma and you're talking about the American College of Cardiology chest pain accreditation, why is that so important?
So kind of like trauma, when we have patients with chest pain, we want to see who's at greatest risk for having an acute coronary syndrome, also known as like a heart attack.
Yeah.
And so what happens is we want to have early recognition first with EKG. So we have, we try to get that EKG as fast as possible. The next step is that we want to get that EKG to the physician to look at that EKG to see, are they having an acute MI, off the EKG or not? And that'll determine, whether we have to mobilize our resources to get the patient either, down to our cath labs at Cedar Crest, or, the other thing would be if there's not signs of an MI on the EKG, then we can proceed with lab work and other workup to see if the patient still may be having an acute, coronary event. And so it's just to help rapidly recognize, get treatment, mobilize resources for those patients that need time-sensitive interventions.
And from what I hear, it's the healthcare here is with heart situations is fantastic. Getting them to Lehigh as quickly as possible. Some of the symptoms that someone has and says, maybe it's this or maybe it's that. What are some of the key symptoms that you would be looking for if you're having some kind of heart problem?
So the most, the classic ones we think of are chest pain with radiation into the arm, okay? Mm-hmm. Sometimes you can have sweating. But other common symptoms that patients may be having if they're having a heart attack may be shortness of breath. It could be weakness. It could be nausea. It could be pain into the back. So it could be a little more vague, and that can be difficult, particularly in patients such as women, because they present very differently, and also patients with medical conditions such as diabetes.
I admire you people who work up here because, you have to have all this knowledge, and it's so, I keep telling our viewers how the Lehigh Valley Hospital and the network has done so much for all the areas they're in. It just fascinates me every time I do these shows. You're also in the primary stroke center, okay? And I understand that's exciting as well.
Yeah, so all this, kind of goes along with like how our MI program is here with our chest pain center. With our trauma program, stroke is another time-sensitive condition that we want to recognize. Now, stroke, is a really awesome program here in conjunction with our colleagues down at Cedar Crest. So what we do here with stroke, there's a few different things. One is we want early recognition. So for patients out in the community, the quicker you recognize someone's having the stroke and bring them here, the better opportunity for possible treatment.
Such as, what would be those?
So what's interesting with it is not all patients qualify for these treatments, but we need to be able to screen them, evaluate them, and get some information like when were they last well, when did these symptoms develop, and some things about their medical history like blood thinners, okay, play an important role, or any history of bleeding. When patients come in, some patients may, if they meet some time requirements, they may qualify to have medication, okay, to treat their stroke if they're not, if they're within that time frame, and they can be treated for that, and possibly we get a CAT scan also to see if they are, candidates to get clot retrieval, okay, which they do down at Cedar Crest. Mm-hmm. So it's a twofold thing. The one thing is to see if they qualify to get medication to help bust the clot. The other thing is to see if that, if there is a clot there that can be retrieved to, help prevent further deficit or permanent deficit. These things, it's a little bit difficult to determine at the time how the patient's going to fare, but to give patients that opportunity at those treatments is really important. And, we want to set patients up to have those best outcomes if possible. There are also patients that, depending on, what we find on imaging and then also timeline and history, they may not qualify for those treatments. And those patients can be admitted here. And they can be medically managed, because one of the important things we want to do is obviously see why the patient had the stroke and see, if we can, medically treat to prevent patients from having further strokes in the future. So it's, it's a little bit of variety. We do work with our colleagues at Cedar Crest, the stroke neurologist. He can actually video in and
Yes.
also evaluate the patient
Right.
to give some real-time, feedback, and we can make these decisions on how to best manage these patients as they present.
So, Doctor, let's talk about some of the recap some of the awards that the hospital has received.
Okay, so, in summary, with being part of these programs, obviously being an accredited chest pain center, meeting those requirements is something we're very proud of. Our trauma accreditation that we received last summer after our previous survey was a huge accomplishment as well, because of the fact that, like I said, it's a very rigorous program, and we got accreditation for 4 years, which is absolutely fantastic.
I noticed that you have a great passion for what you do. All right, why did you decide to go into medicine?
So back in high school, I got involved as a volunteer in a local ambulance as an EMT.
Yeah.
I took the EMT course. I got really involved in that. In college, I actually, that was one of my jobs, was I had a part-time job as a EMT. And I really found out that I really enjoyed medicine. I went on to get my paramedic first before pursuing medical school. And basically that role, being a paramedic, some of the skill set kind of crosses over with immediate stabilization and care. And that definitely built my confidence that, I do want to become a physician, but I want to be an emergency medicine physician. Wow. I really wasn't interested in other specialties. So, coming from EMS, I think that really drove that.
Well, here again, I want to thank you for all that you do and the great care that Lehigh Valley Health Network has been just absolutely fantastic. I know you have a great passion for it. Like I said, my friends, you don't want to be here. But if you have to come here, you want to make sure you have people like this and the health care that they have here. That's the most important thing, is providing the best health care. When we come back, we have more information for you. Welcome back to the Sam Lesante Show, folks. Healthcare is #1 priority for Lehigh Valley Health Network, especially in Hazleton and Schuylkill and all the other campuses that they have. Remember, 24/7, you can watch all of our shows, especially these health shows, very informative, on ssptv.com, and of course our YouTube channel. Continuing on here at the ER department, I open the show and say, you don't want to be here. But if you got to be here, you want to make sure you have the health care and people like you heard of Dr. Weaver. Now we have Neil Kocher, and Neil is a registered nurse, and you are the director of emergency department here, right, Neil?
Correct.
Where are you from?
I'm from Mountaintop. I was born in Wilkes-Barre, but I've been living in Mountaintop for about 31 years. I've been a nurse since 1988, so I was 10 years old when I graduated. And, and I've been very involved with the ER nursing pretty much all of my career.
Well, first of all, I have the greatest admiration for anyone in healthcare, but my wife's a registered nurse, okay? And it's amazing how much knowledge, you have in medicine, she's, we'll watch a program and she knows those health things just like that, it's amazing. So, so tell me, what do you do here?
So my job is, I'm the director of the nurses and the staff here, day-to-day operations, scheduling, recruiting and retention, process improvement, pretty much anything day-to-day that goes on here I'm involved in. And that's 7 days a week, 365 a year.
Okay, so what are some of the things that your team has put into progress here?
So one of the things I noticed when I got here about a year ago was that we had some trouble with getting people through our waiting room in a more timely manner. So we focused on getting people out of the waiting room as quickly as possible. I always tell people that when you come to the ER, it's never expected. Like you said, you don't want to be here, but it's never expected. Nobody plans to come that day. And it's very anxiety. You have a lot of anxiety when you come to the ER. So when you walk in the door, you're already anxious, and then if you have to wait longer than you think you need to, then the anxiety increases. So we've worked very hard, the nurses, the providers, all of the staff, in getting people through the waiting room in a more timely manner, because I feel that the waiting room is the most dangerous place in the hospital.
Yeah. How do you maintain your calm? I mean, you see, because first of all, you have to understand the anxiety of someone coming here, whether they don't want to hear me in the first place. But now you have to take that patient or wherever and calm not only that person down, but maybe their spouse or their family or their kids, etc. I mean, that takes a lot of challenges to me.
It is. It's not easy, because I tell people, especially when you bring a child in, you're not only dealing with the child, you're dealing with the parents.
Absolutely.
So, I mean, you have to have, I always say you have to have empathy, you have to have compassion. Not everybody was built to be a nurse or in the medical field. Certain people that go in it, that has to be one of their core values, is they have to be able to, A, remain calm under pressure, and B, be empathetic and compassionate towards the people they're taking care of.
In training your people, I always say, the healthcare is so important. Now, when someone leaves here or they get a questionnaire and they have to fill them out, how important are those scores, or do you just throw them away?
So, I'm sure there's a lot of viewers out there that are probably putting a face to a name, because I have called probably 300 people in the last year. Because what we do is I follow up on every complaint, whether some people give us very good complaints and they give us a 9 or a 10, and they may make a comment in there that maybe needs to be followed up. I call those people. Anybody that gives us a lower comment because of either they waited or they didn't have a good experience, I reach out to them. I reach out to them pretty much weekly, if not daily. And I've actually spoken to quite a many members in the community over the last year. And I will say that over the last year, our scores, overall experience in the ED, have gone up dramatically in the right direction.
Sometimes the average person does not really know all of the things that are involved when they come here, okay? And sometimes, as they say, some have tunnel vision, right, and they should have done this, and the doctors were this, and etc. And rightly so, you're upset. But I think sometimes, looking at the entire thing, first of all, they're here to help you. They're here to give you the best care possible. And with that respect, I had to come up here 2 years ago for a nosebleed. I didn't want to be here, but they were fantastic. I mean, they were really caring and etc. They try to do everything possible. But sometimes a doctor or a nurse makes, they're trying to do the best. So when those things happen, what do you tell people like that?
So I think most people are reasonable. And when you speak to people, you explain, one of the biggest things that I try to impress on the staff here is that we need to keep our patients updated. So if they're going to be going for a CAT scan, we need to let them know they're going for a CAT scan. How long will the CAT scan be? If you don't really know, you try to estimate it, but you just keep people updated, you communicate well, you explain things, and that goes a long way. Most people that I speak to after they've been upset about maybe a wait time or maybe something with a staff member, when it's explained to them in a way that probably should have been explained from in the beginning, they're reasonable. So I think it's a matter of communication.
Well, Neil, I hear again, as I said to Dr. Weaver, it's you're leaving one patient, then you're going to another patient, and you have all different motions going on, and the nurses here and everyone who works here tries to do their best. Remember, they're human beings too. You know, they have feelings. You have an award here, the Leapfrog Award. Okay, tell me about that.
So Leapfrog Group is a data analytical group of healthcare people that it's a non-government organization that we voluntarily give our data to. So what the Leapfrog Group looks at is our quality measures, such as how many falls have you had in the hospital, how many pressure ulcers have you had in the hospital, how many medication errors, or your overall experience, your patient satisfaction. And it is not an easy, we've scored an A, but I will tell you it is not easy to score an A. And a lot of hospitals can't score an A.
That's fantastic.
So we've done very well over and over and over and over again.
And what does that mean to the community?
Well, it means that when they come in, they're getting excellent care. They're getting, probably the best care that they can get outside of a major city, and they're in good hands.
Let me tell you something. So when you talk about major cities, you go to, sometimes they figure you go to the major city to get better care. Sometimes you're getting rookies and you're not getting the experience that you're getting here. Do you like what you do?
I do. I've always been very fond of Hazleton. I grew up, like I said, I've been in Mount Up for 30 years, but I always brought my family here to this ER. And I always had an affiliation for this ER. I always wanted to work here, and when the opportunity came up as a director, I jumped on it.
So here's what you have. When someone comes in here, they want the best.
Right.
Okay, I want the best doctor, the best. So how do you work, as when they say, oh, he's just a nurse, okay, versus I want the doctor, okay? So how do you, say, I know what I'm doing here?
Yeah. I think, again, it goes back to communication. We work very well with our providers. If a patient wants to speak with a doctor, we go out and we get the provider will come in. Again, like I said, it all comes down to, and that's something I'm emphasizing as the director here, is that we need to communicate as frequently and as often as we can with our patients. And again, if they want to speak with a doctor, we will bring the doctor in.
Yeah. Now, ER is you have to use the ER for what it is. Some people use it as, a doctor's office. And, what do you tell people like that? We're ER here.
Well, anybody that comes in the front door, if they want to be seen, we will see them. We don't turn anybody away, obviously. We will see them for whether it's minor, obviously if it's major, but we will see it. We welcome everybody. I mean, yes, there are some times when they don't have a primary care physician and they'll come here, but we're a judgment-free zone. Okay, yeah. You come in and we see you.
Well, and here again, I think working on the wait time, using it appropriately like that. What else would you like to offer? Tell our viewers about the ER in your position.
I think out of all the years, and again, I've been doing this many, many years, 34 years by my count, and I've been an ER director at many other hospitals, and I will say that this place is the best place I've ever worked. The culture here, the people here, the care here, the community, it is top notch. So I believe that we have one of the best hospitals, at least I've ever worked for.
Okay, so I'm going to ask the same question I asked Dr. Weaver. Why did you decide to go into the medical profession?
So, my father had a heart attack when he was very young. So I remember the ambulance coming to get him, and at first I was going to go on the same route that Dr. Weaver was going to go. I was going to be a paramedic, but then I decided to go into nursing. I think it's something that's innate, and I also think it's something that's based on experience. I don't know if my dad didn't have that happen if I would have gone to nursing, but I think that was a big factor.
That's it. Here again, you have to have a passion for what you do, okay? And I say it all the time, my friends, when you're looking at healthcare, you got the best. You just absolutely have the best here. It's interesting because when someone comes here and as Dr. Weaver mentioned, you have, you can contact other doctors and they're right there for you, So remember, they're here for you 24/7. All of the shows we're doing on healthcare are on the website and on their website. We want to thank you for doing what you're doing and want to thank Dr. Weaver. And we'll see you next time.